So welcome back guys, good to see you back. Here in this particular session we will be talking about a very important program, that is the National Leprosy Elimination Program, right? So let's talk about that National Leprosy Elimination Program, right? So here before jumping into the National Leprosy Program as such, we need to talk about some salient features of leprosy, right? Okay, so the details of leprosy, you will be studying them in the dermatology classes, but here I will be talking about the salient features of the leprosy, so that we shall be talking about our program, right? So the things which we shall be using in the National Leprosy Elimination Program, which we will be talking about, in some features, in some salient points, and then we shall be discussing about the National Leprosy Elimination Program, right? Okay guys, so if we talk about National Leprosy Elimination Program, for that firstly we need to talk about what is leprosy in itself, right? What is leprosy in itself, right? So if we talk about the leprosy, right, basically it is one of the oldest disease, guys. Leprosy is one of the oldest disease, and this is also called as the Hansen's disease. This is also called as Hansen's disease, right? It is also called as the Hansen's disease, right? Basically it is an infectious disease, guys, right? It is an infectious disease which is involving the skin and the peripheral nerves, right? Which is involving the skin and the peripheral nerves, involves the skin and peripheral nerves, right? Skin and the peripheral nerves. It is involving multiple nerves, guys. I will be talking about that most commonly nerve which it is involving, that is the ulnar nerve. We'll talk about that, don't worry, but for now please remember that it is involving the skin and the peripheral nerve, right? Okay, can somebody tell me that what is the causative agent over here? What is the etiological agent that is causing the leprosy? Yes, while I'm writing the answer, yes, it is caused by, yes, I heard that right, that is the Mycobacterium leprae. Mycobacterium leprae, right? So that is the causative agent or etiological factor for causing the leprosy, right? So in the mycobacteria, in the microbiology, guys, you must have studied actually that Mycobacterium leprae is actually the acid fast bacilli, right? It is the acid fast bacilli, just for your general knowledge purpose, nothing else. Okay, so it is a rod shaped, it's a rod shaped acid fast bacilli, right? Next point, basically if we talk about the leprosy, right, usually it is occurring in the clumps which are called as the globi, right? Usually they are occurring in the clumps, right? And they are called as globi, right? Just remember that. Predominantly it is seen in the males as compared to the females, right? Seen in males, and most usually it is involving the age group of 20 to 40 years of age group, right? So 20 to 40 years males are usually affected from this particular disease, right? Usually subclinical cases are more in the community as compared to the clinical cases, right? So can we get it from person? Yes, we can get it from person, but usually the subclinical cases, right, are actually roaming in the community, and they might be actually spreading this particular Hansen's disease, that is the leprosy, right? Most usually, guys, it is affecting the Schwann cells in your CNS. I'm just changing the color for that. It is affecting the Schwann cells, right? It is basically affecting the Schwann cells in our CNS, right? And it might also affect the reticuloendothelial system, right? This was the MCQ, guys, actually, which I wrote over here, that it is affecting the Schwann cells and the reticuloendothelial cells. That was the MCQ once asked in the NEET PG exam, right? Okay, guys. So once we have talked about that, now we shall be talking about, right? So now we shall be talking about some other important points about the leprosy, right? So this is also the important point, guys. Please remember that they are occurring in clamps usually, which is called as a globi, right? Okay. However, and Mycobacterium leprae, I don't think they will be asking you, because this is a very, very easy question, right? Okay. So facts over here, some of the facts, let's talk about them. I have just highlighted over here, right? I have just collected them. So Mycobacterium leprae, guys, actually it is multiplying very, very slowly, and the incubation period of the disease is about 5 years, right? And on an average we are saying it is about 3 years. Symptoms can take as long as 20 years to appear. It's a very, very slow disease, right? As you can see over here, leprosy is not highly infectious. right? It is not highly infectious, as you see in the other communicable disease. For an example, leprosy is transmitted via the droplets, right? By the droplets. So respiratory, way of transmission can be there, respiratory route can be there from the nose and the mouth, right? Okay. And during close and frequent contact with the untreated cases, right? So that can spread the disease. Untreated leprosy might be causing the progressive and the permanent damage to the skin, nerves, limbs and the eyes, right? That is very important point, and I told you that it can involve the Schwann cells and the reticuloendothelial system, right? Okay, what could be the clinical features, guys? Clinical features, you can see that there could be the skin lesions, very important feature, please guys remember this. And skin lesions, we are seeing that a very important pattern, various kind of patterns can be seen in other patients. In the same patient, different kinds of patterns of the skin lesions might be seen as well. In some areas there could be the hyperpigmented lesions, in some areas there could be the hypopigmented lesions, but most commonly it is seen that hypopigmented lesions are seen in the leprosy patient, right? Different kinds of skin lesions might be appearing in the different patients of leprosy, right? So usually, most commonly, hypopigmented lesions are seen, but otherwise many other lesions might also be seen in the leprosy patients. So guys, here we are seeing that hypopigmented or the erythematous patch or plaque. I will be showing you the pictures as well. So that can be seen over here, right? Complete or partial loss of sensation can be there, where we can be seen that painless wounds can be seen, or the burns on the hands or feet can be there, right? The paresthesias can be there, the tingling sensations or the numbness sensations can be there, right? Sometimes the patient might be feeling that, formication. In the psychiatry, you must have studied about that is the feeling of crawling of the insects on the hands, right? So that is the thing over here. Diminished sensation or the loss of sensation within the skin patches can also be seen, right? So these are the different features which we shall remember over here, very important. Thickening of the peripheral nerves can be seen, right? Multiple nerves it can involve. It shall be involving the multiple nerves, and most commonly nerve which it is involving, that is the ulnar nerve, right? Okay. Lumps or swelling can be seen on the earlobe or the face, right? That is, if you will be seeing the leprosy patient, right? There could be the multiple nodular lesions that can be seen in the leprosy patients, right? Okay. And in Hindi, we are calling that as Kusht Rog. So over here, tender or enlarged peripheral nerves might also be seen, which we have talked about earlier as well, right? What could be the risk factors for leprosy, guys? Risk factors, right? If there is a close contact with the untreated cases of leprosy, or the cases which are clinical cases or the subclinical cases in the community, right? By coming in the close contact with them, yes, the disease might spread. So contact of patient with the leprosy have a higher risk of developing leprosy than the general population. Yes, of course, people who live in the areas that is endemic, right? So endemic means the disease which is prevalent in some regions, right? So some regions they have mentioned over here where it might be endemic, some parts of India, China, Japan and Nepal, right? But now in India it is not that prevalent, right? Okay, so these the people who are living in these areas might be susceptible for getting this disease. Then the immunocompromised patients, right? Individuals are more I would say more susceptible to this particular infection, right? So immunocompromised patient, not the immunocompetent, immunocompromised patient, right? And genetic influences can be there in some cases, and it has been seen that on the chromosome 6, right, regions Q25, right, that is a mutation which can be seen over there. If this is a genetic defect, then probably these kind of people might be developing the leprosy in coming time. Armadillo exposure, right? Armadillo, that is the 9-banded armadillo, as you can see in the image over here, right? That is the enzoonotic in the 9-banded armadillo, right? So leprosy is the enzoonotic in the 9-banded armadillo. So definitely the people who are working, hunters or the worker who are working in the forest areas and all, or who are whose occupation is handling the animals and also by coming with the exposure of armadillo, right, they might be getting the leprosy. Okay, right. So what could be the transmission? As I've told you, the droplets could be the transmission route over here. So by the respiratory droplets, that can be the case, but let's see, exact mechanism of transmission is however idiopathic, that is unknown, but most widely it is seen that transmitted by the contact between the cases of leprosy and the healthy persons, right? So basically that is the thing. And nasal discharges, right? Nasal discharges can be there because the leprosy, Mycobacterium leprae can be present in the dried secretions of the nose also, right? That is for about 9 to 10 days. So that is the thing over here. Leprosy is known to occur about all ages, but usually I told you that it is predominantly occurring in the males as compared to the females, and it is affecting in between 20 to 40 years of age group most commonly, right? Okay, but that is not the hard and fast rule as such. Okay guys, once we have talked about that, now we shall be talking about the classification. right? Classification under which program? I am talking about the NLEP, that is the national. So now let's talk about the National Leprosy Elimination Program, right? So once we have talked about some important salient features of the leprosy, right? So now we shall be talking about the National Leprosy Elimination Program. Over here, what we can see, guys, we are seeing the classification, right? We are seeing the classification, right? However, you will be studying about this in the dermatology. Please go through that as well, right? For the better understanding of the leprosy, important features, and about the classification as well. Here I am just touching upon some important features as well. So here, according to National Leprosy Elimination Program, basically leprosy can be divided into two important parts over here. One is the Paucibacillary and other one is the Multibacillary, right? Let's talk about some of the differences over here. Okay, so what could be the criteria that what kind of cases can be coming under the category of Paucibacillary and what can be coming under the category of Multibacillary, right? So over here we are seeing that if we talk about the skin lesions, if there are 1 to 5 lesions with the definite loss of sensation, I told you guys that there could be the loss of sensation within the lesions, right? So if the 1 to 5 lesions are there, then it is coming under the Paucibacillary, and if more than 6, right, if more than 6 or equal to 6, that is the case as far as lesions are concerned, then it will be considered as a multibacillary lesion, right? Then peripheral nerve involvement, if I talk about, I told you the multiple nerves can be involved sometimes. So over here, if there is no nerve involvement or if only one nerve is involved, then it is the Paucibacillary. Otherwise, if multiple nerves are involved, then it is a multibacillary case, right? Skin smear, if we talk about, if it is negative at all the sites, then it is Paucibacillary, and if it is positive at any site, then it would be called as the multibacillary, right? For the treatment purpose, guide, for the treatment purpose, we are using the Rifampicin, we are using the Dapsone, and we are using the Clofazimine as well. But for the Paucibacillary cases, we are using the Rifampicin and the Dapsone, and for the multibacillary cases, we are using the Rifampicin, Dapsone, as well as Clofazimine, that is the addition as compared to the Paucibacillary, right? So in the multibacillary, we are talking about the 3 drugs. In the Paucibacillary, we are talking about the 2 drugs only, right? So please be very clear with that. And one more thing, completion of the release from the treatment over here, right? So here we can see that completion of 6 month pulses in the 9 consecutive months, and here in the multibacillary, it will be taking double time, 12-month pulses in the 18 consecutive months, because as we are seeing that multibacillary is more dangerous one, or I would say that it is the multibacillary is involving the more features as compared to the Paucibacillary, right? So that's why the treatment also takes longer time as compared to the Paucibacillary leprosy, right? Over here we shall be seeing some of the images. For example, you can see this is the hypopigmented patch which can be seen over here in the leprosy patient, right? As I told you, various kind of patches can be seen, but most commonly it is the hypopigmented patch which can be seen. Here also you can see the finger and toes are very shortened over here, right? So here we are seeing the formication. Here we are seeing the formication, right? Formication means the feeling of insects are crawling. Okay, this kind of thing is there. Loss of sensation could be the feature which can be there. These are the lesions, right? These are the reddish colored lesion over here, reddish colored skin patches which can be seen over here with the sensory loss, right? So deformity and paralysis can be seen in some patient. Edema can be seen in some patient. In some patient, there could be the ulceration on the skin surface and all. Muscle weakness, poor eyesight, this could be the feature. So long list of features can be there which can be seen. Non-specific features are seen in the leprosy patient, and basically the skin lesions can be the characteristic finding of the leprosy patient, right? And again, guys, usually hypopigmented lesions are the most common finding, but again various other kind of skin lesions can be seen in the leprosy patient, right? Then I told you about the nerves involvement, guys, peripheral nerves involvement over there. So here you can see that multiple nerves might be involved. If it is only one nerve or if there are no nerve involvement, then we are calling that as Paucibacillary leprosy. And if the more than one or multiple nerves are involved, then it is the multibacillary leprosy. So it shall be involving the supraorbital nerve or the supratrochlear nerve. However, that is rare. Cervical nerve, great auricular nerve, supraclavicular, radial, median. Ulnar is the most common nerve which is involved. Ulnar is the most common nerve which you need to remember, right? Then radial nerve can be there, radial cutaneous nerve, I mean, right? Radial, not the radial nerve, radial cutaneous nerve I am saying. Then which is the part of that one only. Sural nerve can be there, posterior tibial nerve, common peroneal nerve over there. So these are some of the nerves which shall be involved over here, but what you need to remember, ulnar nerve is the most common involvement, right? Over here, if the nerves will be involved, then obviously whatever nerve will be involved, we will be seeing that kind of characteristic feature. You might have studied about that in the anatomy and the orthopedics, that claw hand might be seen due to the median nerve injury, right? Median and the ulnar nerve involvement over here, ulnar nerve, median and ulnar nerve damage. Due to that, the claw hand might be seen over there, right? And here on the second picture you are seeing that neurotrophic atrophy can be seen over there, as you can see here, right? So neurotrophic atrophy can be seen as well, right? So these are some of the features, some of the images related to the leprosy. I hope you had a clear understanding about how the leprosy looks about and how we are talking about the leprosy patients, how they are looking, and what could be the important features regarding the leprosy, and about the classification under the NLEP program, National Leprosy Elimination Program. What if you forget about the program also? Usually leprosy might be divided into two types over here, right? There could be the Paucibacillary patient and Multibacillary patient over here, right? So if we talk about now, right, some more important points over here about the National Leprosy Elimination Program, right? So now let me talk about the National Leprosy Elimination Program, right? However, some important features. So firstly guys, in about 1948, right, in the year about 1948, what happened is there was a program that was called as the Nikusth Nivaran Sangh, okay? And after that what happened is, this is the Kusht, right? Leprosy is also called as the Kusht Rog in Hindi, I'm talking. Then in the year 1983, yes, that was the year when India won their first World Cup in the in the cricket match. So here 1983, that was the time where the National Leprosy Control Program came. National Leprosy Control Program came, and right, which was later on improvised to National Leprosy Eradication Program. Okay, National Leprosy Eradication Program, right? So that is the thing, that is some part of bit of history over here. World Leprosy Day is celebrated on 30th of Jan every year. 30th of Jan every year. However, these kind of questions nowadays they are not coming. These are the historical questions now. Then the theme for 30th Jan 2022 was, obviously now we are approaching towards the 2023. So 30th Jan 2022, there was a theme. They said that unite for dignity, right? Their theme was unite for dignity. This was asked, that's why I'm just mentioning over here, right? Might be asked, never know. So that is the thing over here, unity for dignity. That was the theme for the leprosy, right? Okay. Then guys, one more important data which I shall share with you over here, that annual new case detection rate, that is lesser than 10 lakhs. That is lesser than 10 lakhs, right? What could be the treatment modality over here? We'll come to that. But over here, first of all, let's look at the logo. This is the logo for the leprosy, right? National Leprosy Elimination Program, right? Here, what you are seeing that the lotus is there. This is the lotus, right? So this is the lotus, right? And this is the sun, right? This is the sun, right? And basically sun is telling us about the ray of hope. Sun is telling us about the ray of hope over here, right? And that would be the multi-drug therapy, right? Lotus are the patients over here. Okay, so that is the thing over here. That is the meaning of the logo of this National Leprosy Eradication Program, right? Okay guys, once we have talked about that, now we shall be talking about the modality over here. What are the things which we shall talk about over here? There are two modalities as far as treatment is concerned, right? For the Paucibacillary and the Multibacillary leprosy, we are having the two approaches, and one guidelines are there which are from the Government of India side, and other guidelines are there which are from the WHO side, right? World Health Organization side, right? So over here, let's talk about the treatment modality as well, right? The treatment modality, right? So we are having two categories over here, right? Two categories. So one is the WHO regimen, right? One is the WHO regimen. On the other side, I might be talking about the National Leprosy Elimination Program regimen, eradication program rather regimen, right? So let's just talk about them, like what points they are talking about, right? What drugs they are using and all of these things. So for the Paucibacillary leprosy, for the Paucibacillary leprosy and the multibacillary leprosy. They are talking about two things over here. So for the Paucibacillary leprosy, WHO says that you need to use the 3 drugs, right? For the Paucibacillary, you need to use the 3 drugs for 6 months, right? Whereas National Leprosy Elimination Program says that for the Paucibacillary patient, you need to use just 2 drugs, right? And for same, yes, we will be using it for 6 months, right? So that is the difference which you need to know over here. Second thing, for the multibacillary, obviously you need to use 3 drugs over here. So in both the case that it will be the same, that we will be using the 3 drugs, right? But duration will be double this time, that is the 12 months over here. And this will be the same for the National Leprosy Eradication Program also, that we will be using the 3 drugs, right, for about 12 months, right? So these are the, PB is the right, I'm just writing over here that as well. So PB and MB, what it is. So PB, basically this is the Paucibacillary, guys. PB is the Paucibacillary leprosy, and this is the multibacillary, right? So there should be no doubt in your mind regarding that, at least, right? Okay, guys. Now once you have talked about that, very important, guys, WHO regimen and NLEP regimen, you should remember this, right? You should remember this, important for us, right? So that we shall be discussing it further. Okay, guys. Now what are the multi-drug therapy, MDT, multi-drug therapy regimen and the doses? Let's talk about that, right? So over here we are seeing that one could be the multibacillary leprosy and one could be the Paucibacillary leprosy, right? For Paucibacillary, WHO says that for Paucibacillary, multibacillary, you need to use the 3 drugs, right? But here I am talking about the National Leprosy Eradication Program. They are saying that for Paucibacillary we will be using 2 drugs, for multibacillary we will be using 3 drugs, right? What will be the duration? For Paucibacillary we will be using for 6 months, for multibacillary we will be using for 12 months. That is same for the WHO and the NLEP. It's just that WHO says that you need to use 3 drugs for both the conditions, but NLEP program says that you need to use 2 drugs for Paucibacillary and 3 drugs for the multibacillary. So now we shall be discussing about the this program, that is the multibacillary. For the multibacillary, what drugs we are using, and for the Paucibacillary, what drugs we are using. Let's talk about them as well. Okay, so here they are saying, guys, that for the multibacillary we are using the Rifampicin, we are using the Dapsone, and we are using the Clofazimine. So we are using the 3 drugs in the multibacillary, right? For the Paucibacillary we are using the Rifampicin and Dapsone, only 2 drugs, right? So for the Paucibacillary, let me tell you over here. Firstly, for the Paucibacillary we are using the Rifampicin, that will be given once monthly. Okay, and the dose will be 600 mg. Okay, that is for adults. I'm talking about, right? For the children, that is around 10 to 14 years, the dose will be 450 mg, and below 10 years it will be 300 mg, right? Okay, then about the Dapsone, guys, Dapsone, they need to take it daily. Dapsone, the patient need to take it daily, whether it is children, whether it is adult, they need to take it daily over here, right? But one thing is there, that below 10 years, they need to take 25 mg daily or 50 mg alternate day, right? So that we need to remember over here, right? Other point is that the completion of this Paucibacillary will be 6 months pulses, 9 consecutive months, right? Okay, guys, 6 monthly pulses, completion of 6 monthly pulses, 9 consecutive months, right? Multibacillary, completion of 12 monthly pulses, right? So I told you 6 and 12 you need to remember. For the Paucibacillary 6, for the multibacillary 12, right? In the 18 consecutive months. Okay, fine. Now look, Rifampicin once monthly, that will be the same, how they are taking monthly. We need to take the Rifampicin, that is for Paucibacillary, multibacillary both. As far as Dapsone is concerned, that should be taken daily, right? Daily once. That is same for the Paucibacillary and multibacillary. The doses are changing. For the multibacillary we are using the 600 mg, right? For the multibacillary we are using 600 mg, and for the Paucibacillary also we are using the 600 mg, but that will be for the adults. For the children, the dose is changing, 600 to 450 it is coming, as far as children doses are coming, right? And if it is below 10 years, then it will be reduced to 300 mg, right? Okay, Clofazimine, it should be taken monthly. 300 mg, right? For children 10 to 14 years, 150 mg, and for below 10 years it would be 100 mg, right? One more thing, guys, for the Clofazimine, right? Dapsone, I told you that is the 100 mg dose, right? For the children it will be just half, that is the 50 mg, right? And for the children below 10 years it will be further half, that will be the 25 mg, right? For the Clofazimine, guys, I would like to mention over here that one dose they need to take it monthly, right? One dose they need to take it monthly, but one dose they will be taking daily. So monthly dose which they are taking, that is the 300 mg. but daily dose which they are taking, that is the 50 mg, and that could be your MCQ, guys. Please remember clofazimine. First of all, we should know the drugs. What drugs we are using? We are using the Rifampicin, which is also the ATT, anti-tubercle drug. Then the Dapsone and the Clofazimine. For the Paucibacillary, only two drugs, Rifampicin and the Dapsone, right? For the Multibacillary, Dapsone, Rifampicin and the Clofazimine. Clofazimine we are taking 2 times in this program, right? According to the National Leprosy Eradication Program. Here they are saying that monthly dose will be the 300 mg, but there is the daily dose also for the Clofazimine in the multibacillary leprosy, that is 50 mg. Please remember that. Okay, so that's how we have talked about the multi-drug treatment, multi-drug therapy regimen and the doses according to the National Leprosy Elimination Program, right? According to the National Leprosy Eradication Program, right? So very nice, guys. Now we shall be talking about how the doses are coming, how the tablets are coming actually, to the patients, right? So here we are seeing that for the multibacillary and the paucibacillary, how the patient, how the packets are there, how these are called as pulses. These are called as pulses, right? So you can see, the MDT blister packs, right? These are called as the MDT blister pack, right? Over here we are seeing that for the adult, guys, look over here. For the adult, what we are using? For the adult, for the multibacillary, we are using the pink color packet, right? Pink color blister packet. And for the adult, we are using, for the paucibacillary, we are using the green color packet over here, green color blister packet over here, right? So for the adults, for the paucibacillary, we are using the green color packet. For the multibacillary, we are using the pink color packet or red color packet, pink color packet basically, right? Then we can see that here for the children, I would say, for the child, we are using for the multibacillary, we are using the yellow color packet, and for the for the child, right, for the paucibacillary, right, we are using the brown color packet, right? So that is the thing over here, and you can see that this category which you are using, right, this particular category, right, this particular category which we are using, this category over here, right, that is for the first dose of the month, right? And from the guys, this is the I would say, please remember, this is the multibacillary, right? I would say like this is the multibacillary side and this is the paucibacillary side. Okay, so for the multibacillary, right, we are seeing that on the very first row there is a first dose of the month. Rifampicin, I told you that it is taken monthly once, so that is the Rifampicin. So Rifampicin will be present over here. So probably we are seeing that here we could be seeing that it could be the Rifampicin which is present over there, because it is taken monthly, right? First dose of the month will be taken over here, right? Then dose for the alternate days are coming, right? Dose for the alternate days for the MB, so, right, for the multibacillary, as you can see, these are the dose for the multibacillary, right? And dose from the second day which you will be taking, this is from here, right? Okay, so that is about this one. As far as the paucibacillary is concerned, for the paucibacillary we are having first dose of the month and daily second dose from the second day, right? So paucibacillary is quite easy as compared to the multibacillary, because in the multibacillary we are using 3 drugs, for the paucibacillary we are using the 2 drugs only, right? So that is about the MDT blister packs, right? MDT blister packs, right? So once we have talked about that, now we shall be moving on to some other important points, right? So now as far as treatment part is concerned, we shall be having 3 prophylaxis parts over here in the leprosy, right? One could be the primary level of prevention, then the secondary level of prevention, and the third will be the tertiary level of prevention, right? So let's talk about those prevention as well. So let me talk about the very first one, that is the primary level of prevention, isn't it? So let's talk about the primary level of prevention in the National Leprosy Eradication Program, right? So in the primary level of prevention, guys, we are talking about the awareness, right? Awareness for leprosy, awareness regarding the leprosy, right? So we need to educate the people about it. Then we are using the in the US, right? Basically there is a US mascot for leprosy over there. US mascot for leprosy, there was a popular cartoon character over there, and the name for that popular cartoon character was Meena, right? Probably you might have seen that as well, right? So for the US, there is a mascot for leprosy that is named as famous popular cartoon character, that was Meena. And for India also there is a popular, it is not a cartoon character, I would say that they have introduced this, right, school going school going girl over here, school going children. So they are showing multiple purposes over here, that you should be sending the daughter, beti bachao beti padhao, so sending the daughter to the schools, and you should encourage them to study as well, right? So that is the thing over here. And third thing, that is the Leprosy Free India campaign mascot. Also you can see over here, Leprosy Free India campaign mascot, right? And the name was Sapna. So Indian mascot, right? So mascot for India for the leprosy, right? What was the name over here? The name over here was, that was the Sapna. Okay, that was Sapna. Okay, that was Sapna. So please do remember that, right? Now one more thing, they have introduced the this one, the SMASH program. So it was coming under the SMASH program, that using the mascot, right? They are using the mascot, so it is coming under the they are using the mascot, so it is coming under the Sparsh program. So under the Sparsh program, what is happening? By using the mascot, creating the awareness towards the leprosy in the people, right? That is the mascot program. So in the mascot program, basically it was to create the awareness in the people about the leprosy using the mascot program over here, right? So for us it was Sapna. For India, and the mascot is Sapna, right? And this is the thing which you can see over here, क्योंकि सपना है कष्ट मुक्त भारत का, right? So Sapna means in English it is dream, right? So the dream is the dream of the India is like that should be the leprosy free. So that is the thing over here. So that's why they are serving different purposes, right? Okay. So here, that is the MENA. This is a US mascot for leprosy. This is the US mascot for leprosy, right? This is the MENA and this is the Sapna. Please remember these photos as well. They might be asked, because these days they are asking you the image based MCQs as well, right guys? So once you talked about the primary prevention, now we shall be moving on to the secondary prevention, right? So I guess we shall be talking about the secondary prevention now. So if we talk about secondary prevention here, basically we want to make the diagnosis as early as possible. So early diagnosis and prompt treatment, right? That would be the motto for the secondary prevention: early diagnosis and prompt treatment, isn't it? Right. Then there could be the tertiary prevention. For the tertiary prevention, the government is providing tertiary prevention, right? The government is providing the rehabilitative services. For an example, the free reconstructive surgeries might be provided from the government of India side. So free reconstructive surgeries might be provided, right? Free prosthesis might be provided for the locomotion purpose. Free prosthesis might be provided. Then free microcellular footwears might be provided, right? So these are some of the steps which shall be taken in the tertiary prevention section from the government of India, right? Okay. So if the patient, right, if the patient is on Rifampicin, if the patient is on treatment which we have talked about right now, right, if there is a resistance for that treatment, then in those cases we shall be using the 2-year regimen category, 2-year regimen therapy, right? In the 2-year regimen therapy, we are taking 3 drugs daily, right? We are taking 3 drugs daily. Over here, the drugs which we are talking about for the 6 months, we are taking daily Clofazimine, that is 50 mg, that was same, right? But we are also taking the daily ofloxacin 400 mg and daily minocycline 100 mg or clarithromycin 500 mg, right? If there is rifampicin resistant cases, in that case you shall be using this therapy, that clofazimine 50 mg daily, ofloxacin 400 mg daily and minocycline 100 mg daily or clarithromycin 500 mg daily, whichever is available, followed by, right, that is for 6 months. After that, followed by 18 months of daily clofazimine and daily ofloxacin, that will be 400 mg or minocycline 100 mg, whichever is available. So for the 6 months you will be using the 3 drugs daily, and for the following that 18 months you will be using the 2 drugs daily, right? So for 6 months 3 drugs daily, followed by 18 months 2 drugs daily. That is for the rifampicin resistant cases, right, according to WHO, right? Okay. Now, what are the WHO treatment guidelines? We have talked about the NLEP program guidelines, right? That was Paucibacillary, we were using the 2 drugs. For Multibacillary, we were using 3 drugs. And what I told you, WHO says that either it is Paucibacillary, either it is Multibacillary, we will be using the same therapy only, that will be the 3 drugs, right? 3 drugs, but the difference, but the duration will be different, right? 6 months will be the duration for Paucibacillary cases. For the Multibacillary cases, it will be the 12 months. As you can see the difference over here as well, that they are using the, they are using the 12 months for the Paucibacillary, for the Multibacillary, and 6 months for the Paucibacillary cases, right? So you can see it very well over here, right? Okay, now you can see for the adult and the children less than 10 years, there are different doses basically. So Rifampicin we are using, okay, that would be the same, right? Rifampicin 600 mg once a month, that is same. And right, I'm talking about if it is Multibacillary, then 12 months, Paucibacillary 6 months, we have already talked about that. Clofazimine, that would be 300 mg once a month and 50 mg daily, that is also same. And Dapsone, right, that is 100 mg daily. Dapsone, that is 100 mg daily, right? Dapsone 100 mg daily. In our National Leprosy Eradication Program, right, if you guys remember, right, there it was same. Rifampicin, I told you that was 600 mg, Clofazimine 300 mg daily, 300 mg monthly, and 50 mg daily, right? 50 mg daily, right? And that is written over here as well, that is daily. Okay, so that is the thing over here. So that is same from the WHO side as well, right? Okay, now if you talk about the children, guys, Rifampicin dose will be 450 mg once a month, then 150 mg once a month, or 50 mg daily, and Dapsone 50 mg daily, right? So that is for what? That is for this case, right? But the only difference is Paucibacillary also they are giving the 3 drugs. Clofazimine also they are giving for the Paucibacillary patient, but NLEP was not giving the Clofazimine for the Paucibacillary patients, right? I hope you are seeing the difference as well. So for the less than 10 years, according to the weight, we will be giving the tablets 10 mg per kg once month, 6 mg per kg once month, that will be the dose for Clofazimine, and for the Dapsone it will be the 2 mg per kg daily, right? So that will be the drug regimen for the leprosy patient, for Paucibacillary and Multibacillary patients respectively, as far as WHO treatment guidelines are concerned, right? Now we shall be talking about the indicators of the leprosy, right? Several indicators of the leprosy. Okay, so first indicator which we are gonna talk about over here, that is the ANCDR indicator, right? And this is the most important epidemiological indicator, right? This is the most important epidemiological indicator, right? Sometimes if in case they are asking you, right, or the question might be, they might be asking that which of the following is not an indicator of leprosy, right? Second one which we shall talk about over here, that is the grade 2, right? That is the grade 2 disability, grade 2 disability per 10 lakh population, per 10 lakhs population. Okay, the third indicator which we shall talk about, that is the cure rate, that is the cure rate. And the fourth indicator we shall be talking about, that is the prevalence rate, that would be the prevalence rate, right? Now most important thing which I need to talk about over here, about the grade 2 disability, grade 2 disability per 10 lakhs population over here, that is quite important indicator for the leprosy, guys. Here the question might be coming, right? They might be asking you what is the most important indicator in the leprosy. So most important operational indicator is this one only, most important operational indicator, right? That is the grade 2 disability indicator per 10 lakh population, right? And second one over here, that is that it is the most important health awareness, most important health awareness, right? Most important health awareness or leprosy awareness indicator, health awareness or leprosy awareness indicator as well, right? Okay, now one more thing over here, before closing of this topic, we shall be talking about the grades of disability. I told you that disability might be happening in the leprosy, so grades of disability we shall be talking about that as well over here, right? So in case if the question comes, right? Now the first grade which we shall talk about over here, that will be the grade 1, right? Grade 1, then we shall be talking about the grade 2 and grade 3, right? So grade 1 over here, they are saying that there is usually no disability, so no disability, right? And in the grade 2 there could be the sensory loss, right? There could be the sensory loss or there could be the weakness. There could be the sensory loss, there could be the weakness, but no visible deformity, right? Visibly, right? No visible deformity would be there, right? And if we talk about the third one, that will be the grade 3, obviously grade 3. Here the deformity will be visible, obviously. So that is probably the multibacillary leprosy, right? So here we shall say that in the grade 3, that will be the visible deformity. That will be the visible deformity, right? So in this particular session, we have talked about the leprosy. We have talked about the National Leprosy Eradication Program, right? Please go through it once so that it is crystal clear in your mind, right? So here the main important part was the multi-drug therapy over here, where I have tried to compare the National Leprosy Eradication Program treatment regimen and the WHO treatment regimen, right? So please go through it. I will be seeing you in the next one. Thank you.